Say again? 10 minutes before, 10 minutes earlier, okay? I will let you out 10 minutes earlier. Okay, appendicular skeleton. We're going to start with pectoral girdle. It consists of two components. It consists of the scapula and the clavicle, okay? So many muscles of the upper body, like muscles of the upper limbs, thoracic muscles, they attach to the hands, to the clavicle, to the scapula. Now, the clavicle provides the bracing action to keep arms actually, kind of away, keep arms to the side. Okay, so clavicle works as a braces. Okay. Now, if you would look at the clavicular bone, clavicle, I don't know if I have one. I don't have one in this. Oh no, I do have. So this is the clavicle. Yeah, Holy has one. So clavicle has two very distinct ends. The cone-shaped end is the sternal. It articulates with the sternum, while the flat end is called acromial. Acromial end of the clavicle articulates with the acromial process of the sternum, forming acromioclavicular joint right here. Can you see that? Other than that, there is not a lot of remarkable features, except maybe for the trapezoid line, which marks the attachment of the trapezius muscle to the clavicle. Okay, so this trapezoid line, trapezius muscle is responsible for shrugging your shoulders. Does that make sense? So touching here. Now the scapula is located on the posterior surface of the rib cage. Okay. If you would look at the scapula, there are many elements associated with it. First of all, two processes, acromial and coracoid. Okay. Posterior acromial and frontal coracoid processes. Scapula has three borders and three angles. So the lateral border faces outward, the medial border, and the superior border. See that? So what I may show you, I may ask you, which scapula it is. Like this scapula, which one it is? Left or right? It is. That makes sense? So lateral border is always angular. Okay, now, why it cannot be this way? Because the spine of the scapula always faces backwards. Okay? It's another side of attachment, the large muscles. Does that make sense? One of the distinctive features of the scapula are three fossae. The fossae that faces forward is called subscapular fossa. And that's the site of, that's the location of one of the muscles associated with the scapular movement called subscapularis. Supraspinous and infraspinous fossa That's supraspinous fossa, and that is infraspinous fossa. These fossae are associated with supraspinatus and infraspinatus muscles. These three muscles, subscapularis, infraspinatus, and supraspinatus, are parts of the rotator cuff muscles. They stabilize the joint, the shoulder joint right here, also called glenohumeral joint. If you would look at the scapula from the lateral aspect, from lateral view, okay, you will see that acromial process, coracoid process, and glenoid cavity form kind of a joint cavity. Can you see that? Now, you see that this cavity is sort of, quote-unquote, loose. Do you understand what I'm trying to say? It's not a very, like, look at this. Look at the hip joint. You see the cavity? Solid, deep. This is the stable joint. Loose. This is not stable joint. In fact, this is the most free moving joint in the human body. Glenohumeral or shoulder joint. That makes sense. So please know, for anatomy, no two processes, three fossae, spine. I may ask you, not that I will ask you, but I definitely may ask you to identify not just what is this? Okay, what is this? This is acromial process of the right scapula. So we'll have to pick, is that acromial process of the right scapula or the left scapula? Am I clear? Arm. 30 bones. Let me do a quick overview. Okay, so this is humerus. Part of the reason why I got rid of the short answer anatomy exams is the spelling of humerus. This is not funny. Sorry for the bad pun. So humerus is the most proximal and the biggest bone of the upper arm. It articulates at the proximal end with the glenoid cavity of the scapula, and distal end articulates with ulna and radius. Ulna is medial, and the radius is the lateral bone of the forearm. Articulation of these three bones, radius, ulna, and humerus, form the elbow joint. Clear? So far? Good? Ulna and humerus articulate with 8 rather small bones called carpal bones. They form wrist. I don't want to lie to you, those 8 are the hardest bones to memorize. Carpal and tarsal bones are the hardest to memorize. I will give you a mnemonic at least for carpal. Then you have 5 metacarpal bones. It's your palm. And you have 14 phalanges. 2 for the thumb and 3 for each of the fingers. Does that make sense? Okay? The humerus, the specific parts, parts of the humerus. The head of the humerus articulates with the glenoid cavity. On the anterior portion, you can see the tubercles, the greater and the lesser tubercle. and you can see intertubercular sulcus between them. These tubercles represent the attachment sites of the muscles. Okay. On the distal side, there is a fossa. There are several fossae. First of all, it's olecranon fossa. Olecranon fossa, the bigger one, olecranon fossa of the humerus, provides the place for ulna to properly articulate. If you would look at the arm of Marvin, this is olecranon fossa. Okay. The anterior aspect is the coronoid fossa. Can you see the coronoid fossa? Those parts, those grooves, represent trochlea. Trochlea is like a pulley, right? It looks a little like a pulley. And capitulum. Capitulum is lateral, and it's the site of articulation for radius. Trochlea is in the middle, more medial, and it's site of articulation with ulna. Okay. Two epicondyles finish the picture. So you have lateral epicondyle and medial epicondyle. And it's going to make more sense once we talk about all the articulations and parts of ulna and radius. So radius. The proximal part of radius is called head, right here. You can see the blunt-shaped head of the radius. Head of the radius articulates with the capitulum of ulna, of humerus. Okay, so this blunt-shaped head of the radius articulates with the capitulum of humerus. The distal portion of the radius has the styloid process, and radius articulates with the scaphoid and lunati bones of among the carpal bones, with these two carpal bones, scaphoid and lunati. Okay. Ulna, articulations of ulna. Forms major part of the elbow joint. And if you would look at the disarticulated ulnar bone, first of all, this is head. Okay, you can see a little styloid process, the ulna. And can you see this notch? This is called trochlear notch. Trochlear notch articulates with the trochlea of the humerus. They probably come from different arms. Okay, can you see that? Look, trochlear notch articulates with the trochlea on the humerus. Now, this part of the humerus, this depression in the humerus, is called olecranon fossa. You cannot see it on the picture because it's covered, but olecranon fossa, this depression that I touch with my pinky, this depression, articulates with olecranon or olecranon process of the ulna. Okay, the olecranon fossa of the humerus articulates with the olecranon process of ulna. In the same fashion, coronoid fossa of the humerus articulates with the coronoid process of the ulna. See that? Let me use Marvin. So that's coronoid process. Coronoid process that articulates with the coronoid fossa. That's olecranon process that articulates with olecranon fossa. Does that make sense? I completely dislocated Marvin's shoulder. Okay, kind of, sort of. Does that make sense? Now, ulna and radius, they form joints actually. Radio-ulnar joint, distal radio-ulnar joint here. And the movement is joint. It's not free movable joint, but there's pretty good degree of movement there, due to interosseous membrane. So if you would look at the upper arm, you will see that these guys, okay, ulna and radius, they have a space between them. That space is actually filled with membrane, which allows the radius to move around the ulna. Can you see that? Essentially, it's that movement. Do you know how this movement is called? It's pronation, and this is supination. How you know that? In the supine position, you can hold a bowl of soup. Okay? So that's supine, that's pronate. Does that make sense? So that pronation and supination is possible due to the interosseous membrane between the ulna and the radius, which allow radius to move around the ulna. When I talk about the palm, I always get phalanges and metacarpals out of the way first, because they are simple. "14 phalanges. Numbering. Thumb is 1, pinky is 5. Does that make sense to you? So 1, 2, 3, 4, 5. We good? The phalanx that is closer is proximal. Then there's distal. Sorry, proximal, medial, distal. Okay? Proximal, medial, distal. Proximal, medial, distal. Thumb has 2 phalanges, proximal and distal. There is no medial phalanx. Does that make sense? So you have 3, 3, 3, 3, 12, and 2 more, 14 phalanges. Does that make sense? So I point at, say, this one, and you tell me it's the what? Number comes first. 4th medial phalanx. That's it. Simple. Metacarpals is even simpler, from 1 to 5, period. Okay? Metacarpal 1, 2, metacarpal 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Does that make sense? Is that simple enough? Sorry. The metacarpals. Good? Now, carpal bones. They're hard. I will give you the mnemonic rule. First, the convenient rule of thumb, sorry for the bad pun, where do you start counting them? You start at the thumb, and you start, look, at the proximal line. Does that make sense? Proximal meaning closer to the attachment to the trunk. Do I make sense? Look at Marvin. That's the proximal line. And I start at the thumb. So we have scaphoid, lunati, triquetrum, pisiform. Then we go back and we keep going. Trapezium, trapezoid, capitati, and hamati. Sounds like if I read it 3 times, I will, raise a Satan. How you memorize them? With an effort and with a little mnemonic rule. So where do we start? From the thumb and from the proximal row. The row that is closer to the shoulder. So we start essentially the scaphoid, right? We memorize first letters. Scaphoid. Some. Lunati. Lovers. Triquetrum. Tri. Pisiform. Positions. Trapezium. That. Trapezoid. They. Capitati. Cannot. Hamati. Handle. That's your mnemonic. Does that make sense? So you go from here and you say some, lovers, try, positions, you go back, that, they cannot handle. Couple of tricks. Scaphoid, if you would look at the arm, scaphoid has the shape of the bean, very close to it. Okay? Can you see that? So that's the thumb. Look at this. That's the thumb. That's scaphoid. It's a bean-shaped bone. Okay? Now if you would look at capitati, capitati is located right next to the third metacarpal. If you would look at the capitati in the model of the wrist, you will see that it looks a lot like a Darth Vader helmet. It does look like Darth Vader helmet, and capitati means head. So it's head-shaped bone. Does that make sense? Now, I'm going to ask you, not all 8 of them, but some of them. And you will have to identify one. So please remember the order. There will be a question on the carpal bones. Does that make sense? We clear? Moving on. Hip bones. There are 2 of them, they irregular coxal bones. They articulate with the sacrum, they articulate with the femur right here, okay? Pretty big. Transmit weight of the upper body to the lower limbs. Provide support to the pelvic organs. In females, it's going to be majority reproductive organs, uterus, Also bladder, distal colon. Essentially, in pregnant women, baby is protected by the pelvic bones. It's not as movable as the shoulder joint, but you don't need it to be movable because you have to sacrifice movement to benefit the stability of the pelvic girdle. Each coxal bone consists of 3 fused parts: ilium, superior part; ischium, the posterior portion; and pubis, which is an anterior part of the hip bone. Does that make sense? Now, the surface here on the ilium, you can see it right here, articulates with the sacrum, forming sacroiliac joint. And you can see that this bone has a lot of lines and crests, projections, right? The spines. If you think about it, and if you would look at Arnold's standing there, a lot of massive muscles of the back, of the anterior abdomen, of the legs are attached to the coxal bone. Does that make sense? For instance, muscles like quadratus lumborum iliacus, muscles that maintain your posture, that hold your back, straight, they are attached to the iliac crest. Gluteal muscles, gluteus maximus, gluteus medius, are attached to the gluteal line. A whole lot of muscles that flex your knees and extend your hips are attached to the ischial tuberosity, ischial spine, and iliac spine. Muscles of the abdomen, like the rectus abdominis, the six-pack, okay, and oblique muscles are attached to the pubis. All these muscles that are very strong and powerful, and they work all the time, they contract all the time just to maintain muscle. Essentially, some of them, like abdominal muscles and back muscles, the muscles of the core, they work all the time to maintain your posture. That constant mechanical pulling, constant pulling on the bone creates those structures like the iliac crest, ischial spine, ischial tuberosity, pubic tubercle, and so on. Pubis here, 2 pubic bones articulate with each other, forming pubic symphysis. It's a joint, partially movable. It moves during the delivery. Bones get slightly separated, and then they go back together. So far, good? Now, how do we tell apart the male and the female pelvis? Female pelvis is wider, okay? They have smaller acetabula. Acetabula is plural, acetabulum is singular. Acetabulum is the cavity for the articulation between the femur and the coxal bone. Does that make sense? So in female, acetabulum is smaller, pelvis is kind of shorter, not so deep, and wider. Okay? It's also more tilted forward. Cavity of the pelvis is more shallow, okay, adapted for childbearing. One of the hallmark parameters which allow you to tell apart between the female and male pelvis is the pelvic angle. Here, the angle between pubic bones, if it's closer to the straight or obtuse angle, the pelvis belongs to female. If the angle is acute, it's the male pelvis. Usually what you can do with the pelvis, you can just spread two fingers, pretty much measure the angle. That's something like that, that's male. If you have to spread them really far, that is female. Make sense? So for instance, Marvin is a typical male. Okay? Backward tilted, deep pelvic cavity, narrow, acute angle at the pubis. Does that make sense? Now that shows you the lateral view and the inferior view. So you can see in the females, it's wider. The pelvic outlet is wider. In males, it's narrower. Okay? And in females, the distance between the sacrum, the pelvis, is much wider. So that's male, very close. The sacrum and the ischial part, they close. Now the bones of the leg. There is what, one less? I think, yeah, one less. Yeah, it should be one less. So not 30, but 29 bones. Bones are bigger. That's femur. That's tibia. You can use the femur as a club. Really. As a weapon. Okay. They're so large and heavy because they carry the weight of the entire body. Okay. So you have bones of the thigh. Well, one bone of the thigh, which is femur. Bones of the leg, which is the tibia and fibula. And bones of the foot. Much smaller. So tarsals, metatarsals, and phalanges. Now, femur is the largest and the strongest bone in the human body, represents about a quarter of the human height. So if I'm what, 70, I have no idea how many inches. I think I'm 70 inches tall, 69. So it's going to be 16 and a half. Okay, 17, sorry. 17 inches, that's my femur. How strong the femur is, you can do sort of a mental experiment. Imagine that, hypothetically, you take a femur and somehow rest it upright. Does that make sense? Upright. And then you put something on top of the femur. It doesn't fall, it's just, vertical pressure, compression force. The compression force that femur can withstand is one femoral bone. Is practically equal to the mid-sized sedan. That's one. We have two. Compression force is enormous. You cannot possibly break the bone by lifting heavy. Does that make sense? Unless you have osteoporosis. Proximally, femur articulates with the acetabulum of the hip bone, like this. This part of the femur, called the head, fits right into acetabulum. Head rests on the thinner part of the bone, called the neck, which is the often site for the fractures in elderly who suffer from osteoporosis. Make sense? In the posterior part of the femur, you're going to find the projections that are characteristic for the femur: greater and lesser trochanter. Those are projections that are associated with muscles that flex your knee. Okay? On the distal surface, distal end of the femur, you can see two condyles. These condyles articulate with the tibia. Actually, that's the right match. That's the left femur. That's left tibia. Okay? They articulate with tibia, those condyles, and those projections are epicondyles, representing the sites of attachment for the adductors and abductors of the leg, muscles that are responsible for the movement of the leg in the frontal plane. Does that make sense? Also, on the anterior, femur articulates, although it can hardly be seen here, femur articulates with patellar bone. Can you see patella? Okay. So patella is the little sesamoid short bone. It's patella. Okay. And that's patellar articular surface right here. Patella actually is inside of the tendon. It doesn't just hang around. So if you would look at Arnold again, look at his knees, the anterior aspect of the knee, there's the white tissue, right? Can you see the white tissue? That white tissue is patellar tendon. Patella is inside of that tendon. Tibia. This is the bone of the leg. It's medial, so pretty much it's a leg analog of ulna. Can you see the tibia? Right here. This is the weight-bearing bone. It receives all the weight from the femur and transmits that weight to the foot. Here in this illustration you can see tibia with two condyles and intercondylar eminence. That's where the some ligaments of the knee joint are attached. On the distal surface, distal end, you can see a projection called medial malleolus. This model, medial malleolus, is right here. Okay? This is the attachment of deltoid ligament, one of the many ligaments of the foot. Since your foot experiences the mechanical forces all the time, because it bends, everts and inverts, bends left and right, pulling on the bone creates that medial malleolus. This is actually an easy way to tell from which leg the tibia is. So look at the bone and you say, okay, where is the anterior portion? Anterior portion is where tibial tuberosity is. This is tibial tuberosity. So we figured out anterior. Now we need to figure out if it's left or right tibia. Medial malleolus. So this site is closer to the midline. So if this is closer to the midline, medial malleolus, and this is farther, which one is that? Left. Does that make sense? Fibula, on the other hand, is a non-weight bearing. It doesn't articulate with femur. It articulates with tibia. If you look at Marvin, you will see that fibula articulates with tibia only, and then with the talus bone of the foot. Okay? Does that make sense? Now, you may have heard stories like, the hockey player breaks the leg but keeps playing. First of all, it can be stress fracture. Second, there were examples. There was, I actually watched this game. There was a game, Green Bay Packers were playing someone, and one of their running backs broke fibula on the field, live. It wasn't some nasty break. I mean, he was limping, but since it's a non-weight bearing bone, he could still walk. Does that make sense? And actually, one of the common fractures of the fibula is so-called Pott's fracture. Foot gets everted. I won't be able to jump up. Let me try to use Marvin here. Eversion means that the foot bends outward. Does that make sense? Like this. Okay? So it's like you're walking on the inside edge of your foot. Does that make sense what I'm trying to say? Okay? That's eversion. So when foot gets everted, the deltoid ligament that I mentioned is very sturdy. You can see the deltoid ligament part of it right here. Since it's sturdy and hard to break, instead of ripping the ligament, you rip off medial malleolus often. At the same time, since deltoid ligament doesn't restrict the move of the bone called talus anymore, talus moves laterally. When talus moves laterally, it presses on the lateral malleolus of fibula and creates the fracture right here. Okay? So the fibula is broken. Does that make sense? This is called Pott's fracture. Does that make sense? Now, fibula and tibia also form a joint. Okay? Tibiofibular joint. Here it is. But you can imagine that this joint is much less movable. Unlike pronation and supination that we experience here, pronation and supination in the leg is much, happens to much less extent. Does that make sense? I'm going to talk about these guys and we're going to wrap it up. Phalanges, all the same. The number from the big toe to the pinky. 1, 2, 3, 4, 5. 14 phalanges. Big toe has 2, proximal and distal. Any other finger has 3. Does that make sense? Proximal, little tiny medial, and the distal phalanx. Does that make sense? 5 metatarsals. So, metacarpals in the arm, metatarsals in the foot. 1, 2, 3, 4, 5. We good? And then the large bones, I do not have a good mnemonic for it. Some of them are very easy to memorize. So this one, the big one, the biggest one is calcaneus. It's the heel bone. Okay? You can see Marvin shows you his calcaneus bone. Talus bone see talus? Second largest. This is talus. Talus articulates with tibia, forming ankle. Does that make sense? Then you have fairly flat navicular bone, which articulates with talus. And cuboid doesn't look like a cube, but nevertheless, cuboid articulates with calcaneus. What I usually suggest to sort of remember that articulation, CC, cuboid calcaneus. Okay, cuboid calcaneus, then talus navicular. And then you have three cuneiform bones. Medial cuneiform, intermediate cuneiform, and lateral cuneiform. So here on this illustration, you can see medial cuneiform, intermediate cuneiform, and lateral cuneiform. You can make another association here. You can say that cuneiform bones, medial is under the first metacarpal, intermediate is under second, and lateral is under third. Fourth metacarpal articulates with the cuboid bone. Does that make sense? So, as I mentioned, you're going to have to recognize 7 tarsals, 5 metatarsals, and phalanges. Make sense? Clear? If I don't post the lab in the reasonable time today, flood me with emails reminding me to post the lab. Okay? Now, I'll greatly appreciate if you could put the cranium models in the boxes. They go into, look, these cabinets from this size. That makes sense? Said 2 skulls painted in plain. And bones, slide them in the cabinets, either right or left, from that aspect, okay? Just slide the trays in there, so we don't lose anything.